Hey, hello, and welcome everyone. Thank you for joining us for today's Deep Medicine lecture series brought to you by the Institute for Health and Healing. My name is Dr. Akhil Palanisamy. It's a warm welcome to all of you. I'm a physician at Sutter's Institute for Health and Healing in Sacramento and Roseville, and I'll be your moderator for today's award presentation and lecture. So a recording of today's talk will be available for replay on our YouTube channel after the event. The link is included in the chat below, and we'll also email you the link within the next week. So before we start, I want to go over some housekeeping to prepare you for today's discussion. Please note today's lecture is for informational purposes only. Everyone's situation is unique, so we ask that you seek professional advice for your own specific medical needs. Next, we're going to quickly review how to use the basic functions in Zoom to ask questions and, if needed, get support from our team. So this will be an interactive lecture. You will not be on camera, but we do encourage you to participate. The chat is currently disabled and will be turned on when our speakers ask questions for you to respond to. You'll see the chat icon on the bottom bar of your screen. And if you have questions for the speaker or for our team, click the Q&A icon to type your questions. We have a team monitoring them, and we'll try to respond to as many of them as time allows at the end of the presentation. Your responses are only visible to our team for HIPAA compliance. Next, you can change the view of the slide and presenter by adjusting the slider. Pull it to the left so you have a split screen between me and the slide. If you're having a hard time hearing or seeing anything during the talk, please refresh your screen, check your internet settings or connection, and if you still need help, use the Q&A icon and our team will help you troubleshoot. So now that we've covered the housekeeping items, I want to share more about the Institute for Health and Healing. We offer integrative medicine clinical care, combining the best of conventional medicine with proven healing practices from around the world that serve the whole person. We have integrative medical clinics in San Francisco, San Carlos, Santa Rosa, Roseville, and Sacramento that offer the services listed here. And many of our services are covered by insurance. So before I introduce Dr. Max, we're going to take a moment to celebrate the history of the Deep Medicine Award, featuring our founding medical director of the Institute for Health and Healing, Dr. William B. Stewart, who's now retired. So this award is named after Dr. Stewart's book, which was called Deep Medicine, and the award shares Dr. Stewart's vision for whole person healthcare that goes beyond the physical and mental aspects of health to address emotional, spiritual, social, and environmental dimensions. So please have a look at this brief video.
Starting in 1993, the Institute for Health and Healing began celebrating the art, science, and soul of healing by honoring individuals who exemplified the values of our founder, Dr. William B. Stewart. Let's take a look at some of the past recipients who received the Deep Medicine Award at our gala events. People at the forefront of the new kind of healthcare championed by Dr. Stewart. And let's listen to him share some of the principles that still guide us today.
The planetary healing is going to begin with personal well-being. And so the life and the choices of each individual are essential for the public health and for planetary healing.
The Deep Medicine Award honored individuals who broaden health to include aspects like poverty and pollution, and who deepen the meaning of healing to go beyond the body to include the mental, emotional, and spiritual.
So deep medicine, from my point of view, is actually the reality that everything that we think, everything that we say, everything that we do is either health creating or not. And that's why the personal self-assessment is so important, because the goal in deep medicine really is learning knowledge and skill sets that will allow you to make decisions and prioritize forever. Whereas illness is about the social context in which we find ourselves with disease, the reality of being isolated or dependent or worried, and both need to be engaged. So our symptoms are often an entry point to further assessment.
We remain deeply grateful to Dr. Stewart and the talented group of community leaders who began the Institute for Health and Healing at California Pacific Medical Center. It is now a national leader in integrative medicine with 6 Sutter Health Care Centers in Northern California.
Okay, what an inspiring video. So now is my great honor to present the Institute for Health and Healing's 21st Deep Medicine Award for this year to Drs. Max Barish-Wreden and her late husband, Dr. Don Wreden. So I'm going to speak of them as if they're one person because their trailblazing influence on Sutter Health, on their physician and nurse colleagues, employees, and most importantly, our patients, was accomplished hand in hand, as was their remarkable marriage of nearly 40 years. So Drs. Max and Don brought their knowledge of healing to the patients they served and then went beyond to develop programs, mentor young doctors such as myself, develop quality and safety in the hospitals and clinics. And Dr. Max, using a groundbreaking approach and understanding of integrative medicine, helped thousands of patients move beyond illness to lead healthy lives. And Dr. Don became the top physician leader at Sutter Health and brought clinical quality to the board of directors and the C-suite at Sutter, always leading with a patient focus in mind. Through the untimely and shocking death of Don, Dr. Max showed us all how to move through a cancer journey with grace and resilience. Their lives have surely touched thousands and will continue to inspire many people long into the future. So this is their true legacy, and this is why they were chosen for this year's prestigious Deep Medicine Award.
Well, Akil, thank you so much. I am just so deeply moved to receive this award for myself and for my husband, Don Wreden. So I'm going to show you the award here. Let me get that oriented correctly.
Mm-hmm.
This is a sculpture by Carl Dern, and the title of the award is Moving Toward Insight, which really is sort of a remarkable way to look at how this journey has been for us these past nearly 3 years. So anyway, I'm deeply honored, and I know Dawn would be so honored and grateful to be here as well. So thank you.
Okay, wonderful. So thank you, Max. And then, so without further ado, I'll turn it over to Dr. Max Barish-Wreden for her presentation for today.
Okay. Thank you all for being here today. I'm honored to be able to speak with you. I'm deeply honored to receive this award. Very humbling to see these luminaries, these heroes of mine over the 40 years that I've been in medicine, to stand alongside them. It's a profound honor. I've given numerous talks in my professional life, especially as a part of the Institute for Health and Healing, focusing on things that we can all do to improve our health and our well-being. But today I'm going to talk about something different. I'm going to talk about being with emotions like grief when we receive bad news, what it's like to be a patient or a caregiver instead of a physician. And then I'll be talking in some detail about treatment approaches to cancer, both in the traditional medical world and the integrative medicine model. And finally, I'll be moving into what it means to heal and how we can learn to live fully until we die. And at the end of this inquiry, I hope you are left with a sense of optimism, and I hope the questions that we ponder together may be of benefit for you as you continue on your journey in this life, wherever you may be. But first, some background. As Akil said, my husband, Don, was a leader in medicine from the very beginning. He was a primary care physician with Sutter for 18 years and then served as president and CEO of Sutter Medical Group for over 12 years, and then finally as Sutter Health Senior Vice President of Patient Experience. He retired in March of 2020, which was planned a year prior to that, right before the pandemic. Don's passion was in creating systems of care that would expertly and compassionately serve our community. He was beloved by his patients and his colleagues. My path was a little bit different. My interest in holistic medicine was ignited by spending 8 months in India in 1976, where I became immersed in meditation and healthy nutrition and yoga. And that led to medical school and then eventually a fellowship in integrative medicine with Dr. Andrew Weil at the University of Arizona. In 2012, with the help of colleagues, I left primary care and started an integrative medicine program in the Valley area of Sutter Health. And in 2016, our program became a part of the Sutter Health Institute for Health and Healing. So what is integrative medicine? As many of you already know, integrative medicine combines the best of traditional medicine with complementary, or what we used to call alternative therapies that have been shown to have clinical benefit. It emphasizes whole person care and collaboration between the patient and the clinician so that all appropriate avenues of healing that are important to the patient have been included. Here are what we think of as the pillars, the 5 pillars of integrative medicine. Most of us know these already. We know we should be eating well. We know we should be moving and getting exercise. We know we should be getting sleep and rest. Our environment and relationships are important, and the mind-body-spirit connection is also paramount. So these are all important. They're not going to be the heart of my talk today, however. I'll touch on some of them, but they won't be the heart of my talk. Instead, I want to tell you a story about facing illness and death with intention, hope, gratitude, and love. Life doesn't always happen as we expect and plan for, does it? We hit the unexpected fork in the road. In July of 2022, Dawn is diagnosed with pancreatic cancer, and our world is shattered. We are both physicians. We know the prognostic numbers, and they are not good. The average survival for someone with Dawn's stage of cancer is anywhere from 9 to 16 months. Dawn and I had been together as a couple for almost 40 years when he got sick. Not long before that, we had said to each other that our marriage had never been better, that we had felt so in love. Even after 40 years, we had worked so hard to develop this amazing partnership, not only professionally, but also in our family. And we had been planning so many exciting adventures for our retirement. And now here we are, left feeling unmoored like a ship tossed at sea. So many emotional places to move through for both of us, including sadness, resistance, frustration, anger, and grief. So let's talk about grief for a little bit. Dr. Elizabeth Kubler-Ross was a Swiss-American psychiatrist who introduced the concept of the 5 stages of grief in 1969. These stages are denial, anger, bargaining, depression, and then acceptance. And these are nonlinear emotions that we may experience as we process grief. In other words, we can move from one to the other in no specific pattern. And as you probably know, grief can also manifest with multiple physical symptoms, including headaches, lack of appetite, fatigue, chest pain, physical weakness, loss of sleep, nausea, chest pain, and shortness of breath. In fact, grief is a whole body experience. And when we don't feel it, allow it, and express it, it can settle into the body and manifest as persistent physical symptoms and illness. Trauma, as we know, can do the same thing. The more trauma that we are exposed to, especially in childhood, the more likely we are to experience physical symptoms and disease as an adult, especially if that trauma has not been addressed. I will never forget a patient that I was seeing who had had severe ulcerative colitis for over 40 years. And this is an inflammatory disorder of the colon, an autoimmune disease, and left unchecked can eventually lead to colon cancer. So we worked really hard on improving her gut health and reducing inflammation and stress. We used targeted supplements. She worked on avoiding environmental toxins. And all of these offered some benefit, but she was still symptomatic. But there was one important area that I sensed she still needed to explore, and that was grief. Her grief over the loss of her beloved brother when she was a teenager, a grief that had never really been fully processed. And 1 year after his death, she developed ulcerative colitis. In our work together, she began seeing an acupuncturist and eventually a bereavement counselor who both helped her to acknowledge and feel and release her grief. And with that, her ulcerative colitis essentially went into almost complete remission for the first time in over 40 years without pharmaceutical drugs. And I remember in my fellowship, one of my professors, who was a gastroenterology professor at Johns Hopkins University, told about a similar patient that he had, that when he finally processed his grief and his trauma, he went into remission from his inflammatory bowel disease. So a moment of reflection. When in your life have you faced grief? Or when have you witnessed another person's grief at close range? Sometimes being with another person's grief can feel even more overwhelming than our own grief. And what has helped you to be tender with your own or with another's grief? What has helped you to be with it and to allow it and perhaps learn from it? So just pause a moment. If you want to put anything into the chat, feel free to do that. So moving on, in the midst of our own grief and upheaval, we are also both called upon to take on new, unexpected roles in our marriage, that of patient and caregiver. And to say this was not easy is an understatement. But as the author Roy Bennett once said, growth begins at the end of our comfort zone. And we are definitely at the end of our comfort zone now. Not a single part of our daily routine feels normal anymore. But we also need to focus on the workup and treatment. The workup includes biopsies, lab tests, genetic tests, PET scans, CT scans, ultrasounds, and multiple appointments with oncologists, surgeons, etc. The cancer is locally advanced in the abdomen, what we call stage 3, and not operable. But if we can shrink the tumor with chemotherapy, Dawn may be a candidate to have a Whipple procedure, which is a complicated surgical procedure to try to remove the cancer. The Whipple procedure in conventional medicine is the only hope for a cure. And so we start chemotherapy. And while we are following the advice of the oncology medical team, we also dive into complementary therapies. The traditional team recommends the treatment approach with what chemotherapy regimen we're going to do, and the integrative team helps us to address other avenues of healing. And I want to give a shout out to Dr. Stacy DeAndre, who used to be chief of oncology here at Sutter Medical Group in Sacramento. And she went back to where she trained at Mayo Clinic to start an integrative oncology program with them. But Dr. DeAndre was so helpful for us, especially since it's hard for me, even though I'm trained in integrative medicine, to think about everything that I need to do for my husband. It was really helpful to have other people taking a look and guiding us. So complementary therapies can help to support traditional medicine while reducing the side effects of treatment. And sometimes they can even enhance the treatment, like chemotherapy. And this is the true definition of integrative medicine, isn't it? Using both the traditional medicine and complementary therapies to maximize healing. And I just want to say here also that most medical experts would never recommend using only alternative therapies for cancer treatment. Western medical treatment for cancer is an important and necessary part of the treatment plan, if that is what the patient is willing and desires to do. Many of you may remember Steve Jobs had a form of low-grade pancreatic cancer, and had he had Western treatment, including surgery, he probably would have survived, but he chose alternative therapies only, and he succumbed to his disease. So it's really important to have both experts, both the traditional and the integrative experts involved. So medicine for the mind, such as meditation, guided imagery, visualization, hypnosis, mindfulness practices, intention setting, and expressive writing. These are all things that may help the mind in treatment. These can all help to activate what Dr. Herbert Benson, a cardiologist at Harvard, called the relaxation response. And the relaxation response activates the parasympathetic nervous system, which is what we call the rest and digest nervous system, as opposed to the fight or flight system, which is our stress response. And the body's capacity to heal is activated in this rest and digest nervous system. This helps to reduce our stress hormones like cortisol and adrenaline, and it increases hormones and neurotransmitters like oxytocin, dopamine, and GABA, which contribute to the feelings of well-being and also help to protect and heal the immune system. Medicine for the mind also includes increasing positive emotions like gratitude and releasing negative emotions or suppressed emotions like fear. This does not mean that these emotions won't come up, but again, it's meeting what is arising and allowing it to be, honoring it, and then letting it go. And just a reminder that it can be really helpful to work with a therapist who is trained in this area of psychotherapy. The Sutter Cancer Centers offer free counseling for anyone with cancer, as well as their family members. And of course, the Institute for Health and Healing offers similar services that we'll go over more at the end of the talk. So medicine for the mind includes meditation and deep breathing. As many of you know, when we are facing a grave illness, our thoughts can race and our minds can take us into dark places. Meditation, deep breathing, or being still can help us to calm the mind, to listen to our deepest wisdom or our intuition, and to make the choices that best support our growth and healing. And you don't have to sit on a cushion in order to do this. You can be in nature. You can submerge yourself in water, or you can spend time in prayer. These are other ways to calm the brain and the nervous system. Guided imagery and visualization during cancer treatment can be comforting and also help to reduce pain, nausea, vomiting, anxiety, stress, fatigue, and insomnia. So here's a little exercise. I want you to close your eyes for a moment And think about an imagery that is comforting for you. It could be real or imagined, it doesn't matter. Like hugging your best friend, or being by a warm fire, or holding your child, receiving a hug from someone, petting your dog, or sitting by a stream in nature. Just hold that image in your mind and think about it with as much detail as you can, with as much of many of your senses as you can bring in. And then take some slow, deep breaths. And even imagine that you're breathing in and out through your heart. And feel it fully in your body. And now take a slow, deep breath in and hold it for a few seconds. And then exhale and open your eyes. Doing this for even just a few minutes can produce deep relaxation in the body. We don't necessarily have to sit in meditation for 10 or 20 or 30 minutes. Just stopping and coming into your heart center and imagining something that feels loving and nurturing to you is really powerful. And our brain cannot distinguish between our visualizing an experience the way we just did versus actually having the experience. So putting your mind into those calm and restful places is the next best thing to actually being there. Then let's talk for a moment about intention setting. Setting an intention for your healing can send your body and brain powerful messages about healing. You might ask yourself, what do you have to live for? Having a strong reason to survive and thrive is one of the most powerful things that we can focus on when we are ill. And it helps to empower us to make the best choices for our healing journey. In fact, studies of people who have survived against all odds from cancer, this is one of the most powerful questions. What do you have to live for? Don and I created multiple vision boards throughout his journey, where we had boards where we put up photos or images from magazines about things that we wanted to experience before the end of his life. And it's always remarkable to me about how many of those things actually came into being. And this was especially true when our daughter and son-in-law announced that they were expecting our first grandchild in June of 2023. This was a powerful call to survive. Physician and researcher Dr. Pamela Peeke, who spent time working at the National Cancer Institute in the Washington, D.C. area, once said in a talk, "I never tell a patient how long they have to live. I ask them what they have to live for, because this is a far more powerful predictor of survival and longevity than any medical statistic." Remember, you are an N of 1, meaning the N is number. Like in a research study, we may say there's an N of 100 participants in the study, but you are an N of 1. And while statistics about survival apply to a population, they do not describe possibilities for you. You as an individual do have a fair amount to say about your survival, more than a medical statistic. Hypnosis is another mind-body practice that can help to facilitate healing and also reduce symptoms during cancer treatment. Dr. Steve Bierman, who's director of the new Noetic Medicine Initiative at the Andrew Wiles Center for Integrative Medicine at the University of Arizona, is a physician who is renowned in the use of medical hypnosis to help patients to heal. He also reminds clinicians about the power of our words when we are talking to someone who is feeling scared and vulnerable. Our words, when we are in this lofty position that we are often given as physicians and clinicians, our words can uplift and give hope, but they can also have a negative impact on someone's well-being, like telling them, you only have 3 months to live. And as we know, many people have proven that that is not accurate, but sometimes words like that can cause a lot of despondence. For more on this topic, I highly recommend looking at Dr. Bierman's important book called Healing Beyond Pills and Potions. And this will be available to you, that name, in the resource guide that we have for you. Then moving on to medicine for the body. This includes nourishing food, hopefully organic when possible, to avoid environmental toxins. It can include individualized supplements, healthy sleep, exercise, or some kind of daily movement, and acupuncture. So let's talk about vitamin D for a moment. Vitamin D has been in the news so much over the past 10 years. It's an important nutrient and supplement that is usually carefully monitored by many integrative medicine clinicians. Vitamin D supplementation to achieve adequate blood levels, which we think are about 40 nanograms per milliliter, may reduce the risk of cancer as well as the risk of advanced cancer at diagnosis. And of course, all nutrients are important, not just vitamin D. So it can be helpful to talk with your integrative medicine provider about testing for nutrient blood levels where appropriate. And then let's talk for a minute about medicinal mushrooms. Medicinal mushrooms like turkey tail, shiitake, maitake, reishi, and agarikon may help to improve symptoms and increase survival in certain cancers, including breast, colorectal, stomach, pancreas, and liver. Certain mushrooms like turkey tail are available only as supplements, and these should be discussed with your integrative practitioner. But other mushrooms like shiitake and maitake are available in the grocery store and can be consumed on a regular basis in your favorite recipes. Mushrooms are widely used in China for cancer care. They've also been shown, when consumed on a regular basis, to improve cognition as people get older. As a safe rule, it's probably best to cook all of your mushrooms. This helps to detoxify some potential toxins in mushrooms, and it also helps to break the tissue down to help digest the protein that is available. So it's best to always eat your mushrooms cooked. A review article in 2023 suggested that medicinal mushrooms like turkey tail and shiitake have the potential to prevent lymph node metastasis, prolong overall survival, decrease chemotherapy-induced side effects, and help maintain immune function and quality of life in patients with certain cancers, including stomach, colorectal, and breast cancer. And then let's talk for just a moment about acupuncture, which some consider to be a form of energy medicine, but acupuncture has been widely used during cancer treatment, especially chemotherapy, to help reduce pain, nausea, and vomiting, and also to help improve fatigue and insomnia. And I just want to say, I know we're covering a lot of information in this talk, but I want to remind you that the slides will be available to you after the talk, or you can rewatch the video, and there will be a resource guide made available as well. And finally, medicine for the spirit. This may actually be one of the most powerful things that we can look at. Medicine for the spirit can include prayer or religious practices or participating in a religious community or allowing ourselves to be loved and supported by the people we care about. It includes deepening our intuition and perhaps talking to God or spirit or whatever name you have for a higher power. Journaling and laughter can also be part of medicine for the spirit. In 2013, I trained as a laughter yoga teacher at the University of California in San Francisco. Laughter yoga, which uses a structured form of laughter therapy, was developed by a medical doctor in India in 1995 to help his patients reduce stress and improve well-being. It uses specific laughter practices, which eventually lead to spontaneous, joyful laughter. And multiple studies have shown that laughter has a positive impact on the immune system, As part of my training, we even went into the hospital. We went to the bedside. There were about 10 of us and stood around the bed with this patient and did laughter therapy with her. And we all felt better afterwards. Prayer can also have a positive impact on the body. A study of 112 patients with advanced cancer in Brazil in 2012 showed that praying was associated with reduced markers of inflammation and improved survival. So, back to where we were, Dawn begins chemotherapy, and then we embrace as many of these integrative therapies as we can, and the cancer is responding. His tumor markers are dropping, and after 3 months of a 6-month regimen of chemotherapy, his tumor markers are normal. Hope arises, and he may be a candidate for surgery. We consult with 3 different surgeons, one of whom is very encouraging. So after 6 months of chemotherapy, Dawn has this Whipple procedure in January of 2023. It's a difficult surgery, as I mentioned earlier. The pathology report shows some good signs. The surgeon got the tumor. The surgical margins were clear of cancer, but there were some worrisome signs as well, including a lymph node that showed cancer. Recovery from the surgery was slow and difficult, but after about 3 months, he was really starting to feel better. But 3 months after that, unfortunately, his tumor markers started to climb again, and he was found to have widely metastatic cancer. So now we're going to move into the next section of this talk, which is, what does it mean to heal? Healing does not always include a cure. None of us will live forever, but healing can include surrendering to and trusting life as it arises, surrendering to spirit or God, or however that shows up for you, living and loving fully in the present moment and appreciating the life that we have now, forgiving ourselves and others, being grateful, finding joy and even humor in the present moment. It could also include going back in time to heal wounds that have been covered up for years or even generations, and using whatever time we have left to fully express who we are. And sometimes the process of cultivating these things can lead to physical healing and remission and reversal of disease or prolongation of time on the planet. Here's a beautiful quote from Dr. Rachel Remen, who is a pioneer in helping people with cancer to heal. Healing may not be so much about getting better as about letting go of everything that isn't you, all of the expectations, all of the beliefs, and becoming who you are. So here's a question. Are you carrying expectations or beliefs that do not serve you in your life? And if so, can you find ways to let some of these go so that they are not burdens for you? What matters most to you now? And how can you bring more of that into your life? So just a couple things people have written: staying present, good memories, being in community. So anyway, just something for all of us to ponder. So let's look at the next slide. What are gifts along the journey that we have received? Healing can include letting go of what no longer serves us. It can also include looking for and discovering the gifts or blessings that have come to us throughout our lives, especially those that show up as a result of the challenges that we have faced. It's not the good stuff. The good stuff is great, and we need moments of that, but it's the challenges that we have faced that really have invited us to grow and explore who we are. For example, illness can inspire us to be more mindful, like living each day really as if it might be our last, because it really might be our last, or slowing down and spending quiet time in meditation or silence. And illness can give us the gift of time by inspiring us to take the time to savor small pleasures in life, like the flowers in our backyard, or our first cup of coffee in the morning, or tea, or your favorite beverage, or your favorite foods. Jon Kabat-Zinn, who is a renowned scientist and meditation teacher and also author of many books, once said, "The little things, the little moments, they aren't little. Those really are the essential moments that we don't want to miss out on." Illness can also prompt us to reach out to family and friends, perhaps to those relationships that we have neglected, and to take the time to express our love and gratitude so that at the end of our days, we hopefully carry no or few regrets. Another gift of illness is that it can deepen our spiritual lives. We may find ourselves learning to surrender to life as it shows up each day instead of trying to control everything. And sometimes surrender itself can lead to healing. One teacher, Kelly Turner, in the work that she's done looking at the things that help patients to heal, has said when patients surrender to what's so right now and sort of trust that it's going to work out the way it's meant to, then they suddenly have room for fun and joyful things in their lives. And that in itself is healing. We may become more grateful in this journey, or we may learn to better trust our inner wisdom and intuition. We may develop greater compassion and love for ourselves, for each other, and for the world. One huge gift that came to us during this journey was that we got to welcome our first grandchild, Jamie, and he's now almost 2 years old, so this photo is a little bit dated. But he has brought unspeakable joy into our lives. And so Dawn got to meet his grandson, and there was a very, very beautiful and special connection between the two of them. So I want to revisit for a moment Dr. Kubler-Ross's 5 stages of grief that we spoke about earlier: denial, anger, bargaining, depression, and acceptance. Dr. David Kessler, who was a mentee of Dr. Kubler-Ross, took her 5 stages and added a 6th stage, which is finding meaning in loss. So how do we find meaning after loss, which can help us to digest our grief and eventually become more resilient? Reframing the big questions in our lives, like, why is this happening to me, into, could this perhaps be happening for me? In other words, what am I meant to learn from this path, this journey, maybe this wake-up call? Could this challenge be a call for me to live a more authentic life? You might ask yourself, am I living my best life? Am I living my own life, or am I living someone else's life? What someone else wanted me to do? Sometimes when we don't heed our own inner calling, our body may remind us to get back on track by producing physical symptoms. The researcher Dr. Brene Brown once said, owning our story and loving ourselves through that process is the bravest thing that we will ever do. Could this be a call for courage? So are there things that you would do now if you knew that you only had a year or a month or a day to live? Don't wait. As the great holistic Dr. Lee Lipson-Saul used to say after he was diagnosed with esophageal cancer, is this a good day to die? In other words, have I expressed and done what is most important to me this day so that I will be ready to depart this earth, having loved as best I could and done the things that were mine to do? And if the answer is no, What could you do today to start to change that? Dr. Lipsenthal was one of the founders of the American Holistic Medical Association and died way too young in his 50s of esophageal cancer. So a moment of reflection, is there something you could do today to start living more authentically and intentionally, to really fully express who you are and the gifts that you have to bring to this life? You might also ask yourself if this challenge you're facing could be a call to express more joy or laughter in your life, as we touched on earlier, or make room for simple pleasures. What can you do today to bring joy, laughter, and simple pleasures into your life now? And I can say hanging out with a toddler is a great way to express that laughter and joy. Could this challenge be a call to explore your life's purpose? And please don't get hung up on the word purpose. Your purpose today may be as simple as dancing with your partner or feeding the birds in your backyard. The great spiritual teacher Byron Katie used to say, "My purpose is to spend as much time as I can with my grandchildren." And then there's gratitude. The contemplation of meaning in our lives and of gifts like these leads to gratitude. At least it often leads to gratitude. And one of my teachers used to say, there is always something to be grateful for. Gratitude is a practice, not so much a feeling. And gratitude in being present to the beauty in our lives can lead to a sense of awe and wonder about life and our place in it. The practice of gratitude has also been shown to reap multiple health benefits, including better mood, better sleep, and better relationships. When we first learned of Don's diagnosis, one of the first things that came to mind for me was how deeply grateful I was for the 40 beautiful years that I had had with him. And of course, there was also grief and sadness and all those other emotions, but gratitude was one of the things that showed up first. A grave diagnosis may also open us up to forgiveness. Learning and practicing forgiving ourselves and others for past mistakes is an important part of our journey. We all make mistakes. Make amends where you need to so that you can let go of regret. Be compassionate and patient with yourself. Forgiveness often takes time. But when we learn to forgive, we make room for love, especially for ourselves in all of our human mess. Like gratitude, studies have shown that forgiveness can reap huge rewards for your health, including lowering the risk of heart disease, improving sleep, reducing pain, and reducing anxiety and depression. And for more information about this, check out the Stanford Forgiveness Project or one of the many books by Dr. Fred Luskin, who leads that project. And again, that will be in the resource material. So a final moment of reflection. What gifts has life given you, both the joys and the blessings, but especially the disappointments and losses that have shaped you? Author Rob Bresney published a book in 1999 entitled Pronoia is the Antidote for Paranoia, with the subtitle, How the Whole World is Conspiring to Shower You with Blessings. Wow, that was a wake-up call for me to start looking for those blessings, especially those that were hidden in the hardships. I recently heard a meditation teacher say, let life grace you. And I love that quote. In other words, let life show you the gifts that are sometimes hidden from view. So just question for ourselves. What are the gifts that have come out of the disappointments and losses? These may be the greatest gifts. And finally, eventually, we can tell a new story, one of courage, resilience, and love. And with that, we become healers for our fellow travelers. Don and I had hoped to give this talk together, but his spirit had other plans. And he passed away on January 29th of this year. I wasn't sure if I was going to be able to give this talk, but he's here. He's here with me. He lived almost 2 years longer than we expected, and we believed that integrative medicine played a part in that. While it was a really difficult time for our family, we worked hard to be present to every moment, including the painful ones, because we didn't want to push anything away. We loved him, nurtured him, and cared for him at home. On the last day of his life, he said he wanted to go home, and he died early the next morning. My daughter Julie and I were at his side when he took his last breath. He was so proud of the work that he did for Sutter, and he was equally proud of the work that the Institute for Health and Healing has done to foster healing in our community. Don was a beloved physician, colleague, husband, father, grandfather, brother, son, and friend. He was one of the most amazing human beings I have ever known, and he was the love of my life. This past Sunday would have been our 40th wedding anniversary. And as difficult as this has been, I know he wanted me to survive and thrive. And I also know on a deep intuitive wisdom level that my spiritual journey is meant to continue without him. Life will go on, and we must be a part of that life. If Don were here today, his words of advice would be carpe diem, which is Latin for seize the day, because this is the only day we have, and love each other greatly. That's what he said when people were, when we were parting from being together, he would say, I love you greatly. What a great way to live one's life. So I hope this talk has given you some ideas about living with and treating cancer. And even more importantly, I hope it has given you some food for thought about living and savoring this life that we have now, about learning to let go, to love, and to forgive, so that when our time comes, we can move on to the next life, knowing that we have lived fully and purposefully and joyfully in this life. Thank you so much. Been a great honor. Thank you, Akil.
Wow. Thank you so much, Max, for such an incredibly touching, very moving presentation. I know it was probably not easy at times to talk about these issues, but I feel like it's such an important conversation we're having. These are such crucial topics, in today's times. So there's many questions coming in. So before we go into that, I want to mention that there will be a post-event email in the next couple of days with the full slide deck, the recording of the presentation, and also a resource guide that we have created together with Dr. Max to help you navigate through grief and illness. So before we head into the Q&A portion of the program, I want to introduce Dr. Tony Breyer. Dr. Breyer has been a longtime supporter of IHH, past CEO of Sutter Health, trailblazer and internal medicine physician at IHH San Francisco. So let's hear from her briefly about an important IHH initiative.
Thank you, Dr. Akil, and what a huge thank you to Dr. Max for an inspiring and heartfelt talk. I'm pretty choked up from listening to you, Dr. Max. It was amazing. I feel so moved at how you incorporated integrative medicine and spirituality into your cancer journey. And for over a decade, the Sutter Institute for Health and Healing has had a grant program that offered cancer services to patients that cannot afford them. These services include acupuncture, oncology, massage, nutrition support, and counseling. And this is probably the most difficult time in a patient's life. And these therapies ease their side effects, reduce pain, and improve the quality of life. And I've seen firsthand the difference that these services that we offer make. And here's what some of our patients say. I'm encouraging everyone who has been moved by Dr. Max's talk today to donate to our fund. The demand for services is increasing at a time when our funds have been markedly depleted. And if you've been inspired by our commitment to deep medicine, please consider donating what you can so our patients can continue receiving these services. The donation link is here on your screen, and you can give now or at the end of this talk, and we would really appreciate anything that you can do to help us deliver services to our patients. And I want to give a huge shout out to the many supporters that we have, both on this call and outside, that have allowed us to continue this care. So Dr. Akil, back to you.
Okay. Thank you so much, Dr. Tony. So we're going to go into the live Q&A session. So submit your questions, please, by clicking the Q&A button at the bottom of your screen.